Hi everyone, Frankie Dennis here from Texas Tigress Designs. I'm kind of starting something new that I've been wanting to do. There are things that I believe should be talked about, and OCD is one of them. I know that some people may be coming on and you're probably going to miss some things, so if you would just go back and please watch the whole video. I want to talk about OCD, obsessive compulsive disorder. I have it. Obsessive compulsive disorder does not come on quickly. It's something that comes on gradually. No two people have the same type of signs and symptoms as the others. What affects one may not affect others. It's kind of something pretty unique. A lot of times I'll go into what WebMD talks about OCD, but I'm going to tell you the OCD that I have. Without medication's help, I have random thoughts of, basically it's negative self-talk. I'm working on it. My obsessions are, I like a neat work. I have to be careful. I have a hoarder's obsession. And it's not so much that it is, I just want everything. Being an upcycle artist, I don't like seeing things go into our landfills. And if you've watched my videos, you know that about me. So sometimes I tend to pick up too much, overextend myself, thinking I can do something that physically anymore I can't. I'm having to learn new limitations, which is not easy, but I'm working on it. One of my obsessions is that I don't even realize I'm doing is a picking disorder. You have a scab, you pick it. I don't even realize I'm doing it until I've done it. I have scars on my arms. You can see scars. Here's an example of a picking thing. I've woke up in the morning and found blood from picking a scab. These aren't things that I'm proud of, but I'm trying to help you understand what some signs of OCD are. It's not always, if you know the movie As Good as It Gets, he has one of the symptoms of locking the doors. It's a counting thing. His is a counting thing, and not stepping on cracks and germs, but those are pretty extreme ones, and I feel really horrible for the people. I can't imagine living with that. But that being said, I have my own nightmares that I deal with. Things have to be a certain way. Change is very difficult for me. I'm a planner. I like to plan things. I want to have things go a certain way, and I have an idea of how I want them to get that way. And say somebody has said they're going to help me, or I'll use it for example. I made a lunch date, and due to circumstances beyond my control, my friend cancels. Granted, it's probably a really good reason for canceling, but it's a change. It gives me anxiety. I become very frustrated. Sometimes I become very angry. And all of these feelings are something that just boom in a matter of seconds. It's not normal by any means to get very upset when things change, to have severe anxiety attacks when things change, to just break down and start crying because things have changed again and you're freaking out a little. It's very difficult to deal with, not only for me, but for those who love me, for those who care for me. Sometimes I'm not easy to be around, and I know this. Another obsession that I have is I'm kind of overprotective of friends and family, and I have to control I'm sorry, guys. I'm trying to find the words for some of this. It's really personal. But I want to share because there are people out there dealing with this. They may not even know they're dealing with it. Or somebody say, man, you're OCD. Having random thoughts, negative thoughts, focusing on things that don't make any difference. Worst case scenarios, blowing things out of proportion. It's that little voice in your head that, it doesn't just tell you things like, everybody hates you. It goes beyond the hate, like for that as an example. It goes beyond just everybody hates you. When everybody looks at you, they don't think that you're whatever, fill in the blank. You're getting ready to go on vacation. I'll use this as an example. Getting ready to go on vacation, and this is my service dog, Timmy. He helps me with anxieties. But you're getting ready to go on vacation, and you have an anxiety about going on the road. I have an anxiety about driving in bad weather. I especially have a bad anxiety about driving in snow and ice. Having been involved previously when I lived in Colorado in 4 different incidents that could very well been life-threatening incidents. And no, I'm not blowing that out of proportion. It kind of added to my anxiety now about driving in the snow. So living in Texas is, we don't get that much snow. We get some, but we get ice. And I get really nervous if I'm behind the wheel. But I've learned techniques to deal with it. And with OCD, that's what you really need to do. You need to learn techniques to deal with it. There are some things I give in to OCD on. And there are other things that I really have to fight it and learn techniques to deal with it. So let me get into what WebMD, I'm looking on my phone. Woo! Hard to see, just right. On how do I know if I have OCD? OCD is one of those terms that some people misuse as a way to describe people who like things super clean or arranged just so. But if you have the actual condition that's obsessive compulsive disorder, how it affects your life is very real. OCD usually doesn't happen all at once. Symptoms start small, and to you, they can seem to be normal behaviors. They can be triggered by a personal crisis, abuse, or something negative that affects you a lot, like the death of a loved one. It's more likely if people in your family have OCD or other mental health disorders, such as depression or anxiety. I have all three. OCD symptoms include obsessions, compulsions, or both. An obsession is an uncontrollable thought or fear that causes stress. A compulsion is a ritual or action that someone repeats a lot. Compulsions may offer some relief, but only for a little while. Common obsessions. Obsessions have a theme, such as these: fear of germs or dirt. The symptom: you might be scared to touch things other people have touched, like doorknobs, or you don't want to hug or shake hands with others. Could also be you don't use public restrooms. I know several people who they don't think they're OCD, but that really does fall under the fear of germs or dirt. You don't want to use the restroom that somebody else has used. It's not completely, it falls under the OCD. I'm just going to say that. Symptoms: you might be scared to touch things like people have touched, like doorknobs, or you don't want to hug or shake hands like others. The next theme is extreme need for order. Symptoms: you feel stress when objects are out of place. It's really hard for you to leave home until you've arranged things in a certain way. I have that one. That is one of my things. If I put something, say I organize the kitchen, if something isn't put back where it needs to be, I can't find it, and then I get irritated and I get stressed out. So, yeah, that's a big one. Fear of hurting yourself or someone else. The symptom of that is when you're thinking of something completely different, you have thoughts about hurting yourself or someone else. That one goes along into other disorders like schizophrenia. That's a whole different topic. I don't have it, thank goodness, and God bless you if you do. Theme: excessive doubt or fear of making a mistake. I have that one. Symptom: you need constant encouragement or reassurance from others that what you're doing is right or okay. I'm working on that one, and I look less toward people for that reassurance and look more toward myself and toward God. The only one I need to have approval from is God. And as long as I'm happy with what I'm doing and I know what I'm doing is right, then that takes away, that helps a lot with that particular theme. The next one is fear of embarrassment. You're afraid you might yell out curse words in public or behave badly in social situations. That one really has a lot to do with people not going out of the house, shut-ins. People will become shut in from OCD because of their fears. They just don't want to embarrass themselves, and they don't want to be ridiculed, and they don't want to be looked at, and it goes on and on and on, and that's an obsession. Theme: fear of evil or hostile thoughts, including warped ideas about sex or religion. You imagine troubling sexual or disrespectful scenarios. I am not touching that one. God bless you. Common compulsions like obsession. Compulsions also have common themes and symptoms. Theme: washing or cleaning. Symptom: you wash your hands. shower or take a bath over and over. Several times a day having to take a shower because you just don't feel clean. Washing your hands. Now, I will say this, if you go to the bathroom, be it at home or in public, wash your hands. It's nasty, it's gross, and it's disgusting. And if you haven't been told that, you have been now. Yes, soapbox issue. Theme, checking. You check repeatedly to make sure your kitchen appliances are turned off or the door is locked when you leave. I have this one and can tell you that when you have this particular disorder, part of this disorder, even though you have checked everything, you've checked the windows to make sure they're locked, you've made sure everything's turned off, nothing's plugged in that doesn't need to be plugged in, the dogs are all safe, your pets are all safe, your door is locked, you will leave the house, and on the way to wherever it is you're going to go over that list again in your head. Did I turn off the coffee pot? Did I remember to lock the door? Are those windows locked? You take things. Sorry, guys. My doggies love being in my lap, and I don't mind it a bit. You take things from just your normal random thought of, did I really lock that door? To, oh my gosh, I don't think I locked that door. Did I lock that door? I really don't think I locked that door. And then you start going and obsessing about it, and it's just a common gnawing at you that you can't get away from. Counting. This is one that it dealt with in the movie As Good as It Gets. You say numbers in certain patterns out loud to yourself. You have to count the number of clicks, how many times you lock your door. You count, there has to be a certain amount. If you're making a pizza, you have to have a certain amount of toppings, and they have to be in a certain order. And they have to make sure that they're evenly spaced. That's an obsession. Order, which I just went into with the pizza. You feel the need to eat certain foods in a specific order. You arrange all your clothes or kitchen pantry items in a specific way. I have this one as well. In my closet, my hangers and clothes are on different colored hangers. So dresses are on one color, shirts are on another, pants are on another. These are just things that I do. It's part of my organization. So when I see that color, there's pinks, there's blacks, there's reds, there's yellows, there's blues, there's greens. I know this section is for those. This is for those. Can I know that by looking at it? Sure. But it's one of my obsessions. Next one is routine. You say or do things a set number of times in a certain way before being able to leave the house. This one is like the obsession of maybe you have to vacuum every day. You want to come home to a clean carpet. Before you walk out the door, you have to vacuum. Or you have to make a list of everything you're going to do that day. And if you don't make that list, your day's just ruined because you won't know what to do because you have to make a list. That's that kind of obsession. Collecting or hoarding. Your home is full of things you don't use or need, and you can't stop yourself from buying more. Yeah, it's an issue. Now, I don't call hoarding fabric hoarding. I call that being prepared. Why do I need so much fabric? Because I may want to make something. I don't want to have to go out shopping for it. I just want to go in my sewing room, look in my stash, and find what I need. It's not hoarding. These repetitive routines usually don't have anything to do with the obsession you're trying to fix and can take hours to do. Diagnosis: if you think you might have OCD, see a doctor or psychiatrist. A diagnosis process will likely include a physical exam to see if your symptoms are due to a health condition, blood tests to check your blood count, how well your thyroid works, and any drugs or alcohol in your system. A psychological test or evaluation about your feelings, fears, obsessions, compulsions, and actions. Some level, many people, I think it's supposed to say on. On some level, many people have superstitions or rituals or fears they left the door unlocked or even or the oven on before leaving for work for vacation. Hold on. Click the stupid ad. If you can control those thoughts or think about them logically, it's probably not OCD. If you can't control them or they take up at least an hour of your day and cause problems in your life, it's a sign that it's a time to get help. Now, here's my message on that. There is nothing wrong with getting help. Our society is really starting to go back to a very old way of thinking that if you have a mental disorder, you can't do this and you can't do that and you can't cope. Da 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 da. Sick and tired of hearing it already. Okay? The mental disorder just means that you have an issue mentally that you need to seek help for. People who have heart conditions aren't treated any different. People who have a physical limitation, they're not really treated any different. But if people find out that you have a mental disorder, there's still some people out there that kind of look at you and, you're kind of psycho. No, obsession compulsion does not mean you're psycho. All right, get that straight. It's okay to get help. Medication, in a lot of cases, helps. There's a lot of other things that help. This goes into talking about some of the help available. Well, I guess it doesn't. All right. But I will tell you, okay, I just found it. Okay, this is what is obsessive compulsive disorder. Obsessive compulsive disorder at one time was classified as a type of anxiety disorder, but is now thought to be its own unique condition. It goes beyond the ordinary double checking and worrying that all of us do from time to time. Everybody sometimes wants to make sure the doors are locked and the oven is off. For people with OCD, these thoughts and behaviors are so magnified that they interfere with everyday routines, jobs, and relationships. For example, people with OCD have been known to wash their hands for 8 hours in a day or reorganize their entire household every day. Obsession compulsion disorder doesn't go away by itself. It can be controlled by willpower, It can't be controlled by willpower alone. People with OCD are trapped in patterns of senseless thoughts and behaviors beyond their control. Even after long periods of relatively normalcy, obsessive thoughts and compulsions actions may return without apparent cause. Obsessions are disturbing, recurrent ideas or impulses that intrude on a person's mind. They may take the form of fears that harm will overcome oneself or to a loved one. They may be extreme worry about getting contaminated or dreaded of illness or an overpowering need to do things perfectly. Sometimes these obsessions involve religious, sexual, or violent themes. Compulsive, repetitive actions. Sorry, I've got flies bugging me. They came in with the dogs. Repetitive actions by obsessions. The most common obsessions are contamination, doubt, and loss. These result in the common compulsions of hand washing, checking, and hoarding. Some obsessive compulsive actions, such as uncontrollable counting or praying, aren't obvious to others. People with OCD often fear that if they do not perform these acts, something bad will happen to them or to others. Because obsessions and compulsions may take hold gradually, people often fail to recognize that they are suffering from a form of mental illness. When OCD eventually produces symptoms that interfere with daily life, people may try to hide their compulsions from others and attempt to deal with them by using willpower. People with OCD often feel embarrassed about their obsessive thoughts or compulsions. They may avoid talking about their symptoms even to their healthcare provider. Although OCD can appear at any age, most often begins during adolescence. According to the National Institute of Mental Health, 1/3 of adults with OCD developed symptoms in childhood, and the average age of onset is 19. Some researchers think OCD that develops in childhood is different from OCD that appears for the first time in adults. Men and women are affected equally. In the U.S., between 2% and 3% of the population experience some form of OCD during their lives. Obsession, let me try this again. Obsessive compulsive features are also found in Tourette syndrome, depression, and schizophrenia, which I mentioned before. What causes OCD? In ancient times, obsessive or compulsive behavior was thought to indicate demonic possession. Exorcism was one of the earliest and least successful forms of treatment. Did not know that. Kind of scary, right? The traditional hypothesis from Freudian theory holds that obsessions reflect unconscious desires from an earlier stage of development. Modern understanding about OCD suggests that there is a disturbance of brain circulatory between the frontal lobe and subcortical areas that may also involve dysregulation of the brain. These are becoming very big medical words for me, and my tongue's starting to get twisted. So forgive me, please. Chemicals such as serotonin, especially in people who may have a genetic vulnerability to the disorder. People with OCD sometimes have other other psychological problems such as depression, eating disorders, substance abuse, personality disorders, attention deficit hyperactivity disorder, ADHD, or anxiety. They also may suffer from obsessively pulling out their hair, preoccupation with imperfections they see in their appearance, body dysmorphic order, and the belief that they have a medical illness, hypochondria. These other problems can make OCD much more difficult to diagnose and treat. Let me go down here. Okay, the medical treatment options. And yes, I live in the USA. What are treatments for OCD? OCD doesn't go away on its own. It has no cure. You can't ignore it or think your way out of the repetitive thoughts and behaviors that control your life. What you can control is your decision to get treatment. The first step is to see your doctor. An exam will show if your symptoms are the result of a physical issue. If they're not, your doctor can recommend a mental illness specialist, like a psychologist, psychiatrist, or social worker, who can create a plan for you. For many people, combining talk therapy and medication works best. Cognitive behavioral therapy, which is also known as CBT. OCD has a cycle: obsession, anxiety, compulsion, and relief. CBT, a type of psychotherapy, gives you tools to think and act and react to your unhealthy thoughts and habits. The goal is to replace negative thoughts with productive ones. That negative self-talk will get you. Exposure and response prevention, which is known as ERP. This is a specific form of CBT. As the name suggests, you'll be exposed to the things that trigger your anxiety. You'll be exposed to things that trigger your anxiety a little at a time. You learn new ways to respond to them in place of your repetitive rituals. ERP is a process you may do one-on-one with your mental health professional or in a group therapy, either by yourself or with your family there. Medication. Antidepressants are often first medications prescribed for OCD. Your doctor may have you try, and it lists a whole list of different medications. Talk to your doctor about them. I'm not going to say what they are. You can go to WebMD and look it up. Depending on your age, health, and symptoms. It can take a couple of months for OCD drugs to start to work. They also can give you side effects like dry mouth, nausea, thoughts of suicide. Yeah, here's the thing. Depression medication can give you thoughts of suicide. Okay? That's a whole nother topic I will go into later at a different time on a different video. It can take a couple of months for OCD drugs to start to work. They also can give you side effects, like I said, dry mouth, nausea, and suicide. Call your doctor or 911 right away if you have thoughts about killing yourself. Listen, this is very true, guys. Tomorrow's another day. Okay? I'm just going to go into this little bit on suicide and depression. Tomorrow's another day. We've all had bad days. We've all had months and months of bad days, years that just seem like there's no positive thing out there. If you have depression, if you have thoughts of killing yourself, if you think no one loves you, I'm here to tell you that there's always someone there. You're never alone. You know, whatever your religious beliefs are, so many people believe that there is a God. We may have different ways of worshiping Him. We may have different beliefs of what is expected of us. But you're never alone. God is always there. And being at rock bottom, when you feel completely alone and no one is around, there's no one to help you, you've burned your bridges, you're just at a place that you have self-loathing, you have No hope? There's one who can give you hope, and that is God. All things are possible with God. All it takes is believing. Been there, done that. You are worthy. You are a child of God, and you are a person that isn't done yet. God will call you home when it's your time to come. Until then, whatever you're going through, drug abuse, alcohol abuse, physical abuse, mental abuse, psychological problems, there's help. Hard to find a lot of times, really hard to ask for it, and really hard to admit you need help. But I'm telling you, there is nothing wrong with asking for help. Asking for help takes strength. You may feel weak. You are stronger than you think. Look in the mirror and tell yourself every day, you are stronger than you think. You are worthy. Killing yourself is not an option. Back to OCD. Other treatment. Sometimes OCD doesn't respond well to medication or therapy. Experimental treatments for severe cases of OCD include clinical trials. You could join research trials to test unproven therapies. Deep brain stimulation, where you get electrodes surgically implanted in your brain. Yeah, I have some thoughts of that on my own, but I'll reserve that for another video. Electrocompulsive therapy, convulsive therapy. Electrodes attached to your head give you electric shocks to start seizures, which make your brain release hormones like serotonin. Yeah, that again. My opinion is questionable. Has it got a proven track record? Yeah. Not very humane though. Lots of people died. It's torturous, my opinion. Your treatment goals for OCD are to retrain your brain and to control your symptoms with the least amount of medication possible. Set yourself up for success physically by eating healthy food, exercising, and getting. Emotional support matters too. Surround yourself with encouraging family, friends, and people who understand OCD. This is why I'm putting on this video, is because if you have a loved one who has OCD, if you love them, you love a friend, it's your job to learn about their disorders. It's your responsibility as the person who loves them, as the person who is their friend, to learn about what they're going through. Seriously, if you don't love them, you're not going to take time. If you do, you will. Having people around you who understand you lessens the burden. It lessens the anxiety and it lessens the depression. So it's your responsibility, if somebody you love has OCD, to find out what kind of OCD. Talk to them. If they're still in denial, don't be that person. You have OCD. You need to go see your help, Lose the attitude. Be nice. Be respectful. Do it out of love, not out of convenience for you. And if you have any of these symptoms, I encourage you to talk to your doctor about it. It's okay. There's help available. And learning about your disorder, learning about the thoughts, that's the first step. And realizing what you have. This video has gone on for 40 minutes, 41 minutes. And I know it's a lot to take in, but perhaps someone, sorry about that, perhaps someone, this will help someone. I apologize to anybody that is offended by anything I might say. And I understand that everybody has their own viewpoints. That's the reason I was reading straight from WebMD about what the signs and symptoms are. The other things about me and my viewpoints are mine. We're all entitled to them. We all have a different point of view, and we all walk in different shoes. I can't walk in yours. I can't understand what's going on in your life, but I can relate what's going on in mine, and perhaps it'll help you understand better what's going on in yours. And if you have some of the same things that I do, perhaps it'll help you feel that you aren't alone. There are 200,000 people that have OCD just in the United States. That's not worldwide. And I'm pretty sure that number grows. So just remember, if you take your time and tell yourself whenever one of the negative self-talk things pops in, when that little nagging voice up here won't shut up, you can take control of it by teaching your brain to recognize when it's happening and to stop it. Just make that thought stop and change your thought to something different. Let it go. Let it go, let it go, just let it go. Because you can't change everything. You know, you just can't obsess on everything. You can't buy everything. You don't need to buy it. You need to ask yourself, do I need this or do I just want it? If you just want it and you don't need it, pretty often the answer is don't buy it. If you need it, go ahead and buy it. It's a need. If you don't know what the definition between want and need are, learn them. Just because it is something you want doesn't mean you need to get it. Also, when you have people around you who are very negative and very controlling in a bad way and just always on your case, that's not good for you. That's a bad environment. Been there, done that. It's hard to get away. It's hard to make a change. Don't like change, but it can be done. And sometimes it needs to be done for your health, for your mental health. You're worth it. Take control of the things you can change. Seek help for those things that you can't. Again, my name is Frankie, and thank you for watching the video. I'm not really answering questions too much. Haven't paid attention to chat, and I apologize. But this is more of a informational video and a sharing in hopes that others will learn. So I hope everybody has a blessed day. Thank you very much.